General medical conditions, common infectious diseases, sexually transmitted diseases. STD stands for sexually transmitted disease, and STI stands for sexually transmitted infection. But no matter which term people use, they're talking about roughly the same thing: infections that get passed from one person to another during sex. But what is the difference? The term STI and STD sound similar, and some health organizations use them interchangeably. Technically, however, STIs and STDs are different. Sexually transmitted infections, or STIs, are infections that have not yet developed into diseases and can include bacteria, viruses, or parasites such as pubic lice. They are usually transmitted during sexual activities through an exchange of bodily fluids or skin-to-skin contact where the infection is active. Non-sexual activities in which the bodily fluids are exchanged can also transmit STIs. For example, people who share needles can infect each other with HIV. Sexually transmitted diseases, or STDs, on the other hand, are a disease that results from STIs, and therefore suggests a more serious problem. All STDs start out as infections. Pathogens enter the body and begin multiplying. When these pathogens disrupt normal body functions or damage structures in the body, they become a sexually transmitted disease. However, some sexually transmitted infections may never develop fully into a disease. For example, most forms of human papillomavirus cases go away on their own without causing health problems. In these instances, the HPV is still an STI. If the HPV infection develops into genital warts or cervical cancer, then it is considered an STD. A growing number of public health experts believe the term sexually transmitted disease can mislead people because disease suggests that a person has an obvious medical problem, which is not always the case. For this reason, the term infection is often considered more accurate. You may be wondering what these conditions have to do with sports, exercise, and athletic activity. In 1991, basketball player Magic Johnson announced that he had acquired immunodeficiency syndrome, commonly known as AIDS. The news had a major impact on the sports world, and many of his teammates began to get tested because they were afraid of having the acquired disease. The truth is that up to this event, athletes were seen as superheroes, and little was known on the risk of acquiring sexually transmitted diseases or sexually transmitted infections while practicing sports, and what was the prevalence of these conditions in athletes. The risk of contamination is currently known to be very low, and the possibility lies on the presence of bleeding wounds. The risk of transmission of the human immunodeficiency virus, or HIV, may occur in some contact sports, such as wrestling, taekwondo, boxing, and American football. However, the risk is extremely low, estimated to be around 1 in 85 million games. The risk of transmission of the hepatitis B virus is 50-fold greater than that of the HIV virus. This occurs because the virus is resistant to drying, room temperature, to detergents, and to alcohol, in addition to being stable on surfaces for at least 7 days. Therefore, the transmission of hepatitis B in sports is estimated in about 1 in 10,000 to 1 in 50,000 games. Regarding hepatitis C, there have been reports on former football players that have used injections of vitamin complexes. STIs are among the 5 major causes for seeking medical care and the second major cause of not having a healthy lifestyle among women. Although most conditions are curable, many lesions increase the risk of HIV infection 3-fold, and others are precursors for neoplasms, such as the human papillomavirus, chlamydia, and gonorrhea infections. Chlamydia. It is caused by a bacterial organism. It may result in pelvic inflammation and is a major cause of infertility and ectopic pregnancy in females. Inflammation occurs along with purulent discharge 7 to 28 days after intercourse. Painful urination and traces of blood in the urine and vaginal discharge can be observed. Identification of the infection and the exact organism are important. Chlamydia can also cause conjunctivitis and pneumonia in newborns. Chlamydia is treated with antibiotics. Genital herpes. This is caused by type 2 herpes simplex virus. Signs and symptoms develop 4 to 7 days following sexual contact. Wounds begin to crust 14 to 17 days in primary genital herpes and 10 days in secondary herpes. Females may be asymptomatic, while males will typically experience itching and soreness. There is a development of lesions, and many individuals that are pregnant will be tested for herpes. There is a potential for a mother to pass herpes to a baby during delivery. There is no cure for genital herpes. Symptoms may be treated with systemic medication or antiviral medications to lessen early symptoms of the disease. Trichomoniasis. This is caused by the flagellate protozoan Trichomoniasis vaginalis. Signs and symptoms include vaginal discharge that is greenish, yellow, and frothy. The causes are irritation of the vulva, peritoneum, and thighs, and painful urination. Males tend to be asymptomatic but may experience urethral discharge. Trichomoniasis may be managed with 2 grams of metronidazole that cures up to 95% of cases in women. Males typically require 500 milligrams twice daily for 7 days. A complete cure is required before engaging in sexual intercourse again. Genital Candidiasis. This is transmitted through sexual activity. The signs and symptoms are similar to those of other related conditions. Management is to cease all sexual contact, and this condition is treated through the use of an antifungal cream. Venereal warts. This is transmitted through sexual activity. These warts can appear on the penis, vulva, or anus. Signs and symptoms include nodules that have a cauliflower-like lesion or can be singular. They typically start off as soft, moist, pink, or red swellings, and they develop a stem rapidly. It may be mistaken for secondary syphilis or carcinomas. When warts are moist, we treat them with a medication. Dry warts may be treated with a freezing process. Gonorrhea. This is caused by a gonococcal bacteria which spreads through intercourse. In men, the most common signs and symptoms are tingling of the urethra followed by 2 to 3 hours of greenish-yellow discharge and painful urination. 60% of all women are asymptomatic with gonorrhea. Females will experience vaginal discharge. The management, it may result in sterility or arthritis if it is not treated. Penicillin is a common treatment. Individuals should avoid sexual contact until it is known that the disease is no longer active. Syphilis. Syphilis is caused by a bacterial infection and enters the body through mucous membranes or skin lesions. There are 4 stages of syphilis. Incubation is usually 3 to 4 weeks, but could be anywhere from 1 to 13 weeks. Typically in this stage, painless chancers or ulcers form and then heal within 8 weeks. This can occur in multiple areas. The secondary stage occurs 12 weeks after the initial infection and is characterized by a rash, lymph swelling, body aches, mild flu-like symptoms, and possible hair loss. Latent syphilis is characterized by no or few symptoms, but if left untreated, it may result in tertiary syphilis. Late stage is characterized by deep penetration of spiraceae, which damage the skin, bone, cardiovascular system, and nervous system. Late stage may develop within 3 to 10 years of infection and cause neurosyphilis, which progresses to muscle weakness, paralysis, and various types of psychoses. The signs of secondary syphilis include sores on the palms of the hands and on the body. From 2014 to 2018, cases of congenital syphilis have nearly tripled, 462 cases in 2014 to 1,306 cases in 2018. Congenital syphilis can result in miscarriage, newborn death, and severe lifelong health complications. A mother is likely to pass syphilis onto her baby if she is not treated, so it's important that pregnant women get tested for syphilis. HIV and AIDS. HIV is a virus that attacks the body's immune system. If HIV is not treated, it can lead to AIDS. There is currently no effective cure. Once an individual gets a diagnosis of HIV, they will have it for life. But with proper medical care, HIV can be controlled. People with HIV who get effective HIV treatment can live long, healthy lives and protect their partners. But some people may not feel sick during acute HIV infection, so it's possible for this to spread. When individuals with HIV do not get treatment, they typically progress through 3 stages. But the HIV medications can slow or prevent the progression of the disease. With advancements in treatment, progression to stage 3 is less common today than in early days of HIV diagnosis. Stage 1 is acute HIV infection. Individuals have a large amount of HIV in their blood, and they are very contagious. Some people have flu-like symptoms. This is the body's natural response to the infection, while other individuals may not feel sick right away or at all. Only antigen or antibody tests or nucleic acid tests can accurately diagnose the infection. Stage 2, chronic HIV infection. This stage is also called asymptomatic HIV infection or clinical latency. HIV is still active but reproduces at very low levels. Individuals may not have any symptoms or get sick during this phase. Without taking HIV medications, this period may last decades or longer, but in others it may progress faster. Individuals can still transmit HIV in this phase. At the end of this phase, the amount of HIV in the blood goes up, and specific cell counts go down. An individual may have symptoms as the virus levels increase in the body, and the individual moves into stage 3. Many individuals who take HIV medication as prescribed may never move into stage 3. Stage 3 is acquired immunodeficiency syndrome, or AIDS. This is the most severe phase of the HIV infection. Individuals with AIDS have such badly damaged immune systems that they get an increasing number of severe illnesses called opportunistic infections. Individuals receive an AIDS diagnosis when their cell count drops below 200 cells per millimeter, or if they develop certain opportunistic infections. Individuals with AIDS can have high viral load and be very infectious. Without treatment, individuals with AIDS typically survive about 3 years. Here's one of your chapter critical thinking questions. During a preseason meeting with parents of high school student athletes, several parents expressed concern about any student who was diagnosed with HIV being allowed to participate on the school's athletic teams. According to the parents, at minimum, they should be informed of the name of any HIV-positive student so that they can decide whether or not their child will remain on the team. How would you respond to the parents' concerns and expectations? And back to our lecture. We'll start with menstruation. 28-day cycles consist of a follicular and luteal phase, each lasting approximately 14 days for women. The results of a cyclical hormone pattern. Menstruation is the result of a cyclical hormone pattern. The follicle-stimulating hormone, or FSH, stimulates the maturation of the ovarian follicle, while the luteinizing hormone, the L8, stimulates the development of the corpus luteum and encourages secretion of progesterone and estrogens. These control and inhibit the production of follicle-stimulating hormone when the follicle reaches maturity and is caused by estrogenic steroids. Menstruation is the result of a cyclical hormonal pattern. Progesterone will ultimately inhibit the luteinizing hormone. Before the onset of a new menstrual period, follicle-stimulating hormone levels are already rising to initiate maturation of a new follicle for the next cycle. The physiology of the menstrual cycle, also known as menarche. The onset of menses and puberty normally occurs between the ages of 9 and 17, Although this may be delayed through the strenuous sports training some females participate in. Menstrual cycle irregularities. Strenuous training may alter a cycle. A typical cycle is anywhere from 25 to 38 days long. Menorrhea is a diminished flow. This refers to fewer than 6 cycles per year. Amenorrhea is the complete cessation of the cycle. Ovulation is seldom or not at all due to low levels of estrogen circulation. Amenorrhea can have 2 causes, either primary or secondary. Primary amenorrhea occurs if a female has not had a menstrual period by age 16. Secondary amenorrhea can occur when a menstrual period stops. This is often due to a hypothalamic dysfunction. Gonadotropin-releasing hormone is often deficient. We must rule out pregnancy and abnormal reproductive or genital tract issues, as well as ovarian failure and pituitary tumors. Signs and symptoms of amenorrhea include the complete cessation of the menstrual cycle. Depending upon the cause, females may also experience headache, vision changes, hair loss, excessive facial hair, and milky nipple discharge. The management is reestablishment of the normal hormone levels through a medical examination, nutritional counseling, and the reduction of exercise intensity and emotional stress. Estrogen replacement may be considered for individuals as well. Dysmenorrhea is the painful menstruation prevalent in active women. This may be caused by a hormonal imbalance, ischemia of the pelvic organs, or endometriosis. Signs and symptoms include cramps, nausea, lower abdominal pain, headache, and occasionally emotional variability. The management is to engage in mild to vigorous exercises. Continued activity is encouraged as long as performance levels do not drop. Ovarian cysts can occur when follicular cysts fails to open and release an egg. This can form within one of the ovaries. It typically occurs as a small fluid-filled sac, and most are benign. It may cause bleeding and pain. Unfortunately, these can grow quite large. The causes may include early menstruation, irregular menstrual cycles, increased upper body fat distribution, hormonal imbalances, ovarian cancer, and cancer spreading outside of the ovary. Signs and symptoms. Some individuals may have no symptoms. However, if an individual does experience signs and symptoms, they may experience a dull ache in the low back and thighs, or even will have problems with urination. Pressure in the abdomen and breast tenderness are common. Nausea or vomiting, feeling of fullness, and pain in the abdomen. Weight gain, painful menstrual period, and abnormal bleeding can occur. Pain during intercourse can be another sign or symptom. The management is pain relievers, over-the-counter NSAIDs. Oral contraceptives can help regulate the menstrual cycle. We can limit strenuous activity to avoid cyst rupture and torsion. If there is pain, fever, vomiting, faintness, dizziness, weakness, or rapid breathing that develops, a physician should be consulted immediately. Laparoscopic surgery may be necessary to remove or correct a torsion. Bone health. A decrease in bone is seen commonly in older women and is linked to declines in follicle-stimulating hormone, luteinizing hormone, progesterone, and estrogen. Physically active women with irregular menses are also at risk for bone health issues. Signs and symptoms include increased risk of stress fractures, decreased bone mineral density. The management is decrease in training volume, increasing the total caloric intake, and increasing calcium supplementation. Estrogen replacement therapy is another treatment that we can use. The female athlete triad. This is a relationship between disordered eating, amenorrhea, and osteoporosis. This is often seen in females driven to meet standards of the sport or to meet a specific athletic image to attain goals. Signs and symptoms include disordered eating, anorexia nervosa or bulimia, osteoporosis, which is premature bone loss in young women and inadequate bone development. Management, prevention is the key. Early identification, education, and mental health counseling can help. Pregnancy. Physically active and competition can be engaged in up until the 3rd month unless complications are present. Some individuals may even be able to continue activity until the 7th month. Many women do not continue past the 3rd month due to a drop in performance. There is no indication that exercise is harmful to fetal growth patterns, although extreme exercise may result in low birth weight. Individuals should avoid activities that involve severe body contact, jarring, or falls. Contraindications include pregnancy-induced hypertension, preterm rupture of membranes, preterm labor during prior or current pregnancies or both, an incomplete cervix, persistent 2nd or 3rd trimester bleeding, and slowing of intrauterine growth of the baby. An ectopic pregnancy. A fertilized egg implants outside of the uterine cavity due to an inflammation of the fallopian tubes or a mechanical blockage. Signs and symptoms include amenorrhea, tenderness and soreness on the affected side, referred pain to the shoulder, pallor or blanching of the skin, and signs and symptoms of shock and hemorrhage. The management is operative treatment is necessary to terminate a non-viable pregnancy and control hemorrhaging. This is considered a medical emergency, so referral to emergency medical services is warranted.